Every 60 seconds, a digital millionaire is created. Using the power of the internet, you're now able to access an entirely new world of digital entrepreneurship and education at the click of a button, swipe of a screen, or FaceTime call. Digital education platforms have become the #1 go-to source for learning new skills and entrepreneurship development. The e-learning space currently generates close to $100 billion per year in revenue, and by 2025 is estimated to generate over $325 billion. Are you interested in how you could get a piece of the pie while leveling up your knowledge and entrepreneurship skills? What if you had the power to access the world's best educators in technology, real estate, Airbnb, Turo, transport, financial literacy, and other industries at the click of a button? What if all you had to do was turn on your computer, phone, or tablet anywhere in the world to connect with subject matter experts in a comfortable, self-paced environment, teaching you step by step how to claim your stake in that industry? What if you could skip traditional education, avoiding crippling loans and interest rates, while taking the shortcut to learning the skills you really need to establish the life you want? Would you be interested? Our digital learning platform, education available online. Using our proprietary learning management system, we place the power of digital entrepreneurship and online learning in your hands. When you get started, you'll gain access to dozens of hours of video trainings, workbooks, and dedicated lessons built just for you. You can ask questions, test your knowledge, and learn how to apply your newfound skills in the real world. Our vision for the future is to have every top course around the globe available.
It's such a great honor to be able to raise funds for Living Beyond Breast Cancer organization. Yes.
I'm Renee Knorr, model, creative director, founder of Global Women Wealth Warriors, Wellness Hub, and GW3 Magazine. I dedicated my life and devoted my career into helping women and girls to achieving their goals. I've been passionate about empowering women and enriching men. This opportunity in working with the Global Women Wealth Warriors have afforded me the pleasure of traveling outside of the country to be a support unit, most importantly, to help impact and change lives. Our ultimate purpose is to help others to become whole from finance, spiritual, mental, as well as physical. We know there are challenges and obstacles to get you to the next level. However, it's time for you to level up.
And hello, family. Oh my goodness. Today is Thursday. So happy that you're joining GW3 Live for our not only, health and wellness segment, but today we're going to be learning about so many great things to help you guys with the preventative health measures and health tips. Last week we had a powerful segment, and this week we're looking forward to having our very own Dr. Hyacinth Crooks alongside with Dr. Zeudiann Coleman to join us again. Guys, are you ready? Are you ready? Well, thank you guys so very much for joining GW3 Live. I'm Renee, Knorr. It brings so much joy whenever we have the opportunity of being able to bring so much education into your homes today. And we're looking forward to today being a very powerful segment. It's not only about Thursdays, but it's about health and wellness. Let's talk about it. Our first beautiful guest is the one and only Dr. Zeudiann Coleman, and we absolutely adore Dr. Zeudiann Coleman. Everything that she brings to the table, it's always wonderful seeing you on Thursdays. How are you doing today, Dr. Zeudiann Coleman? You have to unmute.
Hey, now you can hear me.
Like, now I can hear you. How are you doing today?
I am doing awesome. I got to carry that healthy vibration like you are, so I'm matching it up. I'm leveling up today.
I love it, just love it. But I cannot wait for our conversation today. And let's bring up our very own Dr. Hyacinth Crooks as well. She's a phenomenal doctor. I want you guys to both introduce yourself. Tell everybody what it is that you all do. I think it's always best when we hear it directly from you all. How are you doing today, Dr. Hyacinth?
I am doing awesome. It's been a beautiful day.
Yes. Oh, I love that color on you. Purple is truly your shade of color. Yes,
Royalty.
it is. Well, today is going to be a powerful day. I'm looking so forward to. We left off last week was just so many gems. We had so many people that were so excited about our segment. But before we jump right into our segment, why don't you guys take the time, introduce yourself, let everybody know exactly what it is that you do. And we'll start with you, Dr. Zeudiann Coleman. Take it away, please.
Wonderful. Well, thank you so much for having me on your platform. You are just the master of network, and I just love the fact that you pour into other women in their business and also into the world as a whole, trying to help them with their health and their wealth. And my name is Dr. Zeudiann Coleman. I am a chiropractor. I'm a holistic chiropractor here in Atlanta, Georgia. And the name of my business is Z Chiro Med Spa, as you see. And so what we do is we help people with their aches and pains, whether it's from work or play. And so I am passionate about helping people and educating them about their health and how they can do it alternatively, be more proactive, and looking and researching to things that are out there that can help, more like health hacks, so we can live a better quality of life without, dependent on medication or dependent on anything really. So I'm just happy to be on this platform to share some information about how we can do that.
And we're really excited to have you here also with us, Dr. Zeudiann Coleman. Dr. Hyacinth Crooks, why don't you go ahead and introduce yourself to everyone as well?
Okay. Hi, everyone. My name is Hyacinth, and I'm a family nurse practitioner. I have been doing this for over 30 years. Can't believe that. But my main emphasis is family health. I love OBGYN and I love bringing those new babies in the world. And so I try to do as much as that as I can. It involves a lot of teaching, a lot of, discussing how to do things, breastfeeding, contraception. So I do a lot of women's health. Mainly why it's my passion is that we tend to not get the ears of our providers when we go in the office. Oh, well, that's normal for now. Let's try A, B, C, and D. And if that doesn't work, then I can't help you. That is not right. I think my passion is to go figure it out. I may not have the answer right at this minute, but I'm sure as heck gonna do some research about your problem that I'm going to try to help you with. I love the herbal medicine, and I know for me, people have been surviving for years on alternative medicine. It has its place. So does, the antibiotics and medication for, a short period of time. So my job as a healthcare provider is to get you started maybe on some medication, transition you to some herbal or holistic medicine so you can have a quality life.
Mm-hmm.
And I love how she said that quality life,
Mm-hmm.
Yeah, the quality life. So one of the things we wanted to talk about, those preventative steps. We don't want to really be the ones that's constantly reacting to what's taking place. And I'll just go ahead and introduce myself to those who may not know who I am as well. And guys, while we're doing this live segment, we want to encourage you guys to share this information out. We're on YouTube alongside we're on Facebook. And the greatest opportunity we have is to make sure we bring this information to so many others. Whether you're also on our WhatsApp, we want to make sure we send the information to you there. Whether you're on our LinkedIn or whatever the case may be, we truly want to help you because it's all about incitement and education. I realized that with the Global Women Wealth Warriors, being able to found such an amazing organization, one of the things I really wanted to make sure that we were very proactive in doing is just staying, that's it, healthy. Because we know our health is at the center of everything that we do. If you don't focus on your health, you really can't really have that wealth. So not only was it important for us to stay within our health regimens, but also to provide other ways for not only the women, but also the men, the entire family to have healthier regimens. So therefore we can work on that longevity when it comes down to home, when it comes down to living a healthier lifestyle. So guys, we're going to get into this conversation. Feel free to not only tune in with the Global Women Wealth Warriors on Facebook alongside with YouTube, as well as right here on Instagram. Usually on Instagram as well, but today we're live. We're live on the YouTube channel as well as on the Facebook. And if there's questions that you want to ask us, we would love to also hear from you as well. Okay, guys? Today is, again, it's Thursday. And it's how we take over our health and wellness on our Thursdays. And some of the things that I just want to ask you guys, because, it seems as if stem cells, everybody, it's like the buzzword right now. Yeah. And maybe it's been around much longer, but I'm going to share with you guys, I haven't really understand as much about those stem cells as I would like to. So I'm going to be very straightforward with you all. I'm looking forward to learning from you all in regarding to why is stem cells so important in preventing and helping us to have that, being able to live a healthier life and also a longer, healthier life. So ladies, I'm looking to you for the answers. Dr. Z, can you give us some insight and that information for us, please?
Okay, so, I'm going to break it down really, really simple. And I'm sure Dr. Hyacinth might give you a different perspective. I'm going to give it on the holistic perspective. For me, stem cells is exactly what it is. It's a stem cell. It's like, it's at the, it's at the base of most cells. So you can make other cells from these stem cells. And there's a big word for it. I'm not going to have your audience get confused. I'm going to keep it really simple. And so from these stem cells, you can make any cells, right? You can make bone cells, you can make joint cells, you can make cartilage, those stem cells they are the predecessors to other cells.
Mhm.
And so why is it important to have those stem cells is so that our body is like that house that needs repair over time. And when you're, first of all, when you're building a house, you start with the basic building blocks. So you need those stem cells to build. So when you look and see in the research, a lot of times they're getting stem cells from embryo tissues. Why is the stem cells there? Because the baby needs to develop and form and all that. So definitely you're going to have a lot more stem cells when when you're a baby, because there are processes and things to be made and formed and developed, not repair and replenish yet, but at this point you're building. So your stem cells are very active as a baby, when you're growing, etc. But once you reach the age around 30 to 35, your little carpenters, I call them. And every so often, after 35, it's 50% dormant. So half of your your stem cells are, retired. And then by 65, almost all of them are retired. So can you imagine your carpenters that were building and repairing, replenishing, and fixing, and when you're a kid, you scab your knee and boom, it heals. You need something to, you grow to a teenager, grew hair on your face, all that stuff, right? All that has slowed down when you reach 35. And that's when most of us find we're experiencing the signs of aging. Okay. The little aches and pain, it doesn't come all on you all at once. I remember at 35, I'm giving my age, that, I really didn't feel anything. I was staying healthy. I was exercising. I was eating healthy. I was in chiropractic school. So it's all about health and wellness. So I was exercising practicing a lot of those things. But it's just inevitable that we are going to wear and tear. You get into practice, you start, wear and tear on your joints and your body, and, you get enough sleep and more stress and all that. All those things create free radicals in your body, all this bombardment of stress on your body. And where are my stem cells? They've retired. They've been retiring for a while. So now with the new technology and a lot of research on stem cells, I remember hearing about stem cells when Christopher Reeves, broke his neck, and, they went into dive with stem cell therapy. And he was, doing a lot of experimental station, and saw a lot of progress has come out of these celebrities. Not that it wasn't around before, but the celebrities that were able to participate in some of these trials, and each step brought us closer and closer to where we are in our knowledge about stem cells. And to break it down, it's just, those little carpenters in your body that helps to repair, replenish, rejuvenate, regenerate, all of that. And, at some point they retire. And, as we get older, that's really when we realize, oh, my little carpenters are retired. How do we get them back out of retirement is the question. Yeah, so I hope that was clear and simple. But I'll give the mic to Dr. Crooks, because she's gonna give us more detail, and I'm sure the picture will come together.
Okay, for me, learning about stem cell is that it's a branch from, or a bridge, you might say, from being 35 to help you stay healthy when you get to 60. As inflammation is a major cause of all the itis we have, pancreatitis, bronchitis. The main culprit there is inflammation. Now, stem cells, think of a newborn baby that has everything. I think Dr. Z talked about this. Everything it needs to create different cells. The cells for the eyes, cells for the lungs, cells for the heart. And so once we get older, these cells don't work as well anymore. And so we're getting all these problems. We don't get rid of inflammation as we normally do, as quickly as we usually do when we're in our 20s and our 30s. Things tend to linger on. And so with stem cells therapy, it's a medium that will help to well, okay, enhance all the things that you're doing, help you to get those cells working again. For instance, if you're taking your omega fatty acids, all right, and you know that is for the cardiac system, that stem cell is going to help to make it work better, because it's going to help to regenerate some of those cells for the cardiac system. So just think of it right now, not as a band-aid, but as a conduit to take these things to take to your cells, so we can build them, so we can regenerate some of these cells that we need, brain cells, heart cells. And so we're not, having some of those illnesses that makes us feel sick and, can't get up out of bed, our knees hurting, our joints hurting. It is not going to cure everything. It's not a cure all, but it will help to at least decrease some of those symptoms, taking you back to that 20s and that 30s. And so it can, you can just function a little better. It's just it's not a pill.
There you go. Can you hear me okay?
Yes, I can hear you now.
Awesome. Awesome. I mean, such insightful information. Right now, you got the chats blowing up. I love how you
I think we're frozen.
Are we frozen?
We're good now.
Okay.
We're good now.
I love how you all have been able to break it down with some of the benefits, as well as just understanding the importance of, the importance of us being able to rejuvenate those stem cells. And I know that has been some of the ways I've seen that, like you talked about Superman. We always call him Superman. I don't care. We don't have to call him by his first name. Superman. His skin came back and looked so much tighter, right? It was like being able to find that, it's almost like that baby skin almost, because it was so much, I guess, and you can correct me on this, but it seemed as if it definitely rejuvenated more cells, so therefore everything got tighter. Is that usually what happens as well, doctors?
Absolutely, because stem cells, like I said, help to replenish, repair, rejuvenate. And stem cell is known to help with collagen production. And so a lot of times you'll find some precursors to the stem cell therapy in like creams and so forth. But because he was on the therapy for stem cell therapy for his nerve damage, it was actually helping his whole body. And that's what it does. The stem cell is not going to be like, oh, I'm just going to take care of this part right here and not this one. It's going to take care of the entire body as a whole. And it's going to work on the areas that it needs to work on based on the signals that it's getting, where the inflammation is, where the fires are, because the body has signals that's, kind of call them and say, hey, fix this, fix that. So definitely, you'd see these are some of the changes that will happen. Even though you're worrying about the knee and you want the cartilage, that may take time, but you might see that your skin is clearing up, that your skin looks plump and more youthful. Vision might come, even might be something that's improved. Cognitive, your brain cognitive process might be better. And, a lot of things that we could have done easily as a child, those things you'll see kind of coming back. And it does take time. And I'm sure that with him, he was on, a lot of therapy trying to get, the repair of, those damaged nerve cells.
Mm-hmm. I think what's important, we always talk about the early preventative steps. If we can really start doing things to prepare our body, of course, it's about a mindset too, but really, if we start taking the actions in regarding to doing things to prevent it, that would help so much probably in not only the transitional portion, but also just with even detecting certain diseases. I understand even with these stem cells, it can help with health issues as much as diabetes. Is that right?
Yes.
Could you repeat the question? I didn't hear it.
Okay. I'm so sorry. I said with early prevention, it can help us to not only to prepare ourselves from, I guess, it plays a pivotal role with our health, and also with us being able to have, I guess, preparing ourselves with certain diseases, right? Let's talk about diabetes, health issues that seem to have regular screenings that a lot of people are doing, especially in the African American community. So with that, how could also these stem cells could help in that area to, like I was sharing with you, just kind of like being preventive, taking some steps so therefore we can start being proactive to be more health conscious about different health issues that we may be having internally. You share with us if that's something that has also been supportive with those who have diabetes or even cancer or any other type of diseases from stem cells.
Well, I would say that we don't want to think that stem cell, like I said, is a band-aid for anything. It's a conduit, like Dr. Crooks was saying. And basically, you have to do the right things, the right measurements, preventive, like you were saying, to facilitate the stem cells to work at their optimum. And so it's important for patients and caregivers to understand that stem cell therapy is not a cure for any condition or any clinical state, because that would be a misleading situation. But it is definitely a way to it is definitely a way to help the body heal itself. And so, as you know, with diabetes, the excess, glucose in the blood is definitely what's affecting the arteries, is affecting the organs. And so it creates that, what would I say, free radical breakdown and inflammation. And so when we are using stem cells, they can actually reduce the inflammatory response that people may be getting with diabetes. So Dr. Crooks was saying, is that most disease start with inflammation. Anything with the itis, if it's pancreatitis, which that could facilitate diabetic stuff, or it's arthritis, which I see a lot in my office. But let's just be clear that it is not the cure, but it definitely will help with your body healing. So you yourself have to make those important steps as far as diet, exercise, those kind of things, to help reduce your chance of having metabolic syndrome, which is diabetes, hypertension. What's the other ones? All the stuff that we are having issues with in our community. We take those measurements by being proactive, and of course, having stem cells to, if we were to activate our own stem cells, that will definitely push our health to the next level. So, like I said, it's a conduit. So you're doing the right things, but your stem cells are, in retirement. Let's get them out of retirement and get them going. So that can help reduce those inflammation. That's going to help with repair and replenish. That's going to help with rejuvenating what was, that's diminished in their structure and function. So that's my take on, how it helps with disease. And, I don't treat disease in my office. I treat the body as a whole, as far as helping the body heal itself. Mm-hmm. So, that would be my approach with my patients. Be proactive for preventive. And then if you have a way of getting your stem cells to activate, it could be done nutritionally. It could be done different ways. There are new technology out there, which, I don't know if you want to start talking about that, but it's the conduit to getting you to the next level in your health. Definitely. What do you think, Dr. Crooks? Because I'm, this is my...
Well, since I'm in the, primary care area, so I see a lot of people, with diabetes. Mm-hmm. Now, just a definition of what diabetes is. It's where that blood sugar, the insulin is unable to get that blood sugar into the cells where we need it. So basically, it stays in the circulation, and so we have all problems. Excessive sugar causes problems with your heart, kidney, lungs. All those organs are going to be having issues. Mm-hmm. Type 2 diabetes, which is mainly happens after you reach that 45 and 50, in that later stage of life is usually diet driven. We're packing in the foods that we're lacking in fiber,
Mhm.
because everything is so refined now. So
Mhm.
here's where stem cell comes in. All right, it's going to enhance what you do. If you're changing your diet, you're exercising, doing all that stuff, that
Yeah.
stem cell is going to help you. About anybody can reverse type 2 diabetes.
Mhm.
It is reversible. And so that's where stem cell comes in. It's not going to cure it, it's not going to change it. But with whatever you use or whatever you do, be it diet, increase your fiber, exercise, then that's where the stem cell is going to come in and enhance those things that you're doing. So, that's how it will work in helping with diabetes.
I love what you added there, Dr. Crooks, as well. From the exercise, our regimen, what it is that we're doing, as even the importance of the foods that we're eating as well, where we don't even realize the importance of how we are supposed to have a healthier diet. Then I know, let me just say this, guys. I've been really bad on the cashews this week. I don't know where they come from, but I've been eating too many cashews. And by far, probably cashews are like the worst thing you can eat out of all nuts because it has so much fat in them, right, doctor?
No,
No,
it's
it's
good
okay for
for
me to eat
you.
cashews?
It has magnesium in there. Fat keeps your stomach full. No, I mean, you got to just do the minimum amount, or how much you're
Right.
supposed to have, the servings. But there's nothing wrong with your cashews. It's just how much you eat. Just
Mhm.
try to make sure you're eating one serving, because that fat keep you satiated, keep you full. And the magnesium in there, which we're lacking in, because most people with high blood pressure is a lack of magnesium.
Mm.
So you're getting that magnesium and you're getting that fat in. That's going to keep you from eating a whole lot of other stupid stuff.
And you're right about that, because I was noticing my stomach is like so full, and I'm like, I don't even want to eat anything. I guess I picked that habit up from my dad growing up. He used to always eat nuts. We had a
Mm-hmm.
pecan tree in our backyard. Back in the
Good
day, we had
stuff.
some good things, right? So we had the pecan tree, and so my dad would always eat his nuts, and so I didn't know, but I'm so happy that I'm doing well. Thank you, Dr. Crooks.
Yes,
I
ma'am.
mean, I get a check mark. I like that. All right.
There you go. There you go.
Yes, yes. I want to just think about, and I want to answer any questions that we have in the chat as well. And I'm going to look through the chat. Just, I see some of them are saying like preventative, and definitely is a key component to better health. They agree. That's the Global Creative Group. And then also we got Miss Veronica Atkins. She said, great information, Queens. If anyone have a question that you want to ask the doctors, they are in the house. It's Thursday, and we focus on that Thursday. It's all about the health and the wellness. And we're talking about, guys, stem cells. That's today was something that was really important. I also see that we have one of the persons that just wishing you guys look so beautiful. Everybody's excited to see you on the screen. Well, I want to ask this question. When we think about, proper rest,
Mm.
and I want you all to address that, how important it is for us to also have that proper rest, even when we're in the process of rejuvenating. Like I said, I have yet to do the stem cells. I really haven't done that at all. Have any one of you all experienced it before? Ooh, okay.
Yes.
Okay.
Not
I know
not
my daughter.
not like traditional stuff.
Okay, all right.
Yes.
No, my daughter had to do it because Janae had four acts. She had four surgeries, and she
Mm.
tore her ACL and her meniscus. So definitely they had to utilize those stem cells to kind of like rejuvenate that area, especially on her left leg. Oh my God, I didn't want to think about it. But talk to me about your experience, in regarding to what it is that you had to do, and like you said, just the natural approach, because it's very healthy for us as well. So Dr. Zeudiann, please share.
So you want me to share my secret?
Uh,
You want me to share my secret? Okay.
Spill the tea. Come
Oh
on.
my God, I gotta spill the tea. I gotta spill the tea. Okay. So, 40 plus and living well, that's my
Woo!
thing. And I mean, some of it is genetics, but definitely if my stem cells, like I was saying earlier, my little carpenters are out of retirement, I can definitely stay looking younger and healthier and feeling healthy and vibrant longer. And so what I implement in my office, because I'm more holistic, I have a way of activating my own stem cells through a wearable wellness patch. And so that is my little secret. As a matter of fact, I have one on right now, and I wear it for 12 hours every day. And basically, it is a lifestyle change for me too, because like we were saying, you have to be proactive with your health, the foods that you eat, the those nuts that you're eating, the vitamins that you're getting from your vegetables, the water that you're drinking, the sleep that you're getting. All that is very important for your body to replenish, repair, and rejuvenate. So while you're sleeping, really, your body is at work. It's almost like once your eyes close down, your stem cells and the rest of the other organs, your detoxing organs, everybody's at work trying to get you where you need to be in homeostasis by the time you wake up to face the world and all the other things and stressors that are going to be bombarding your body. So my stem cell secret is a patch that I wear, and I basically wear it every day. I've been wearing it for possibly almost a year now, because it's almost October again. And, I like to try my stuff out first before I start talking about it. So, it's kind of like I'm talking about it now. And, I've actually introduced it to some of my very critical patients, and they've had great results. So it's another way, a health hack, a way of stimulating my own stem cells without the injections. And I know the one that you're talking about is where we are, collecting stem cells either from the embryo cells or even from the person, where you're pulling, their own blood, centrifuge down their own stem cells into a concentration and put it back into the knee, the shoulder, wherever. And, those procedures can be costly. And sometimes if it's not your own stem cells, your body will reject. So with me, finding this new technology, and if you guys need more information, I can certainly share it some other time, that actually activates my own stem cells, require no downtime, no surgery, nothing. It's just with energy, your own body energy. We call it photomodulation, where you're actually using your own energy to stimulate a copper peptide, which is in your body anyway, and that elevates your stem cells. So there is a lot of science behind it, research, etc. There's places that I can send you where you can get that information. PubMed have a lot of information on copper peptide and how they are directly related to stem cell therapy. GHK copper peptide is the specific one that when I'm wearing my patch, it stimulates and elevates my stem cells. So, if you see less wrinkles on my face, I don't know. I just, and just so I be clear, I'm also doing other things to help, because, the stem cell is just a carpenter. They're just the workers. So you have to take your vitamins. You have to take your NMN. I don't know if anybody talked about that yet.
Yeah. The vitamins.
Definitely.
Did anyone say vitamins?
Yes, you got to take your B12. You got to take your B complexes. You got to take your vitamins. Those are the building blocks for the carpenters to mix and put things together.
Taking their stuff. Yeah.
Exactly. So another secret. I mean, all my secrets are out the bag now. Okay. So my Forever Young spray, which I've been using, and basically along with my stem cell, I have to help my little carpenters. I give them things that it needs: water,
Yes.
Your
Yes.
body is 75%
Hydration.
water. I mean, even if you weren't doing stem cells, you should be on your water, period, right?
Yeah.
Yes.
Right.
And then your vitamins, your organic foods, detoxing, making sure you don't have too much toxins in your body, because that's going to increase more inflammation and giving your stem cells more work to do. You know, you want it to get to those areas, right?
Yep.
Right. So if you create more inflammation other places, it's going to be working in other places. So help your body help itself. And you know, your water, your sleep, like you mentioned, Miss Renee, sleep is so important, because that's really when your body is actually healing and repairing. So you want to make sure you get good sleep, and that's where I do my dreaming, for deep REM sleep, so I know my body feels rejuvenated. So I'm basically, you know, like she said, like Dr. Crooks was saying, it's a conduit. My stem cells are working for me, but I have to give it what it needs. Those nutrition, those vitamins, the magnesium, those coenzymes, those minerals that our body needs is so important to supplement, because we're not getting it 100% in our foods. So, I don't know if that was a secret, but
Yeah.
it's
Oh,
out.
you let a lot of those secrets out the bag, and I think it's so important for our viewers, because I know you guys are listening, you're tuning in. Make sure you share this information out. Genetic testing can really help you guys to be able to identify exactly what is taking place, because everybody's have a personalized, everything is personal for each person. So keep this in mind, okay?
Yep.
I was speaking to the doctors, and I just love their insight. If you're enjoying this conversation, guys, go ahead on and put some hearts in the chat as well. As they call me, the Queen of Hearts. I just love taking shit. Yes, I'm the Queen of Hearts. I'm the Queen Mother. I get so many new names. Just don't call me a name I don't want to answer to. How about that? Okay.
Exactly.
Yeah, but I think it's also, we talked about the diet, we talked about exercise, we talked about the healthcare choices. Dr. Crooks, maybe you can give us some insight in this area. And thank you so very much, Dr. Zeudiann, because girl, you was definitely give us those secrets. But what I love about it, you're being honest. And that's something that we need to face up, because where we are and how we're taking care of ourselves, I can't just sleep upside down like a bat anymore. I got to do something extra, okay, in order for me to preserve what am I going through. And that's a great question to tie us into this one right here. I mean, that's a nice subway to tie us into this question for you, Dr. Crooks. Emotionally, how can this also affect others as well? Because let me just say this. We know from Botox, and we didn't even talk about the Botox. That's a whole nother situation, but stem cells, sometimes I think what I've been experiencing, what I've been seeing, I think it's more of like people like it just for cosmetics, as opposed to maybe just enhancing here and there. And I've seen that some people even have overdone it as well. But I love to see like those Michelle Pfeiffers alongside with some of those icons, like even Denzel Washington. They're keeping it natural. Share with us, if you decide one way or the other, if you want to do the stem cells, or even if you don't want to do the stem cells, the emotional connection, as well as how that can improve in our well-being, because that's something that's so important as well. Please share with us, Dr. Hyacinth.
Okay, as we all know, we age differently. Okay. I look at my mom, and my mom is in her 80s, and she looks very good. I have no complaints about, the way she looks. And she didn't do anything. She didn't put lotions and serums on her face and, all that other stuff. And she still looks good. All she used to wash her face is water. I mean, no soaps, no nothing. And her skin looks beautiful. Well, my idea is of her, looking at her, and I have some of her genes. I kind of look like her too. But if she does nothing and she looks great, what can I do for me? And that's where the idea came in. I am not the one to be, injecting and doing all that stuff. But I promise you, all the little things. I keep telling people that, I'm 21, but actually in my age paper, I leave my age on my age paper. It says 61.
I'm 25. 25. Are we forever 25?
Yes, I'm 21. And anybody asks my age, I'll say I'm 21, but my age paper said 61. All right. So by saying that,
You look amazing. You look
I
amazing.
know.
Oh my God. Come on, put some hearts up.
Woo! Hearts.
So,
hearts, everybody.
Yeah,
Woo!
I look back at my gene pool and I'm like, if I do the little things, the exercise, eating right, by the time I get to 80, I should look greater than my mom. And so when the stem cell came along and all the benefits that it had, I was like, okay, that's something. I'm not sticking anything extra in my face, and then I have to wait for it to go away in a couple of months or weeks. This is something that I can use to enhance what's already in my body. This great genes that I got from my mom and my dad, I want to keep it looking good. For me, emotionally, when I look in the mirror, I feel good about what I see. If I can feel good about what I see, all the other stuff that's going on in my life, I can deal with. So for me, looking in the mirror, liking what I see, and feeling good about how I'm aging, because honey, I'm gonna age and things are gonna change. And one of the things, I never had those aches and pains and all that other stuff. My thing was hot flashes, and I could not stand those things. So whenever I wear my stem cell, and I have it on right now, and my patch, this is what it looks like.
Mm-hmm.
And so when I take it off, I even asked if I could wear it for 24 hours, but no, you have to take it off that 12 hours so your body can, you regenerate and use it well. So it gets rid of my hot flashes. Most people probably won't work for them, but that's what it does for me. And I skipped yesterday and I started today, and I'm burning up. So when I skip days, I get hot. And by the time I take it off in the evening to go to bed, then I'll have hot flashes. Then it will work differently for everybody, because our bodies have different needs. So please don't get it because you think it's going to work for your hot flash, and it won't. Just try to see if it will work on the needs that you have.
Mm-hmm. Absolutely.
Ooh, I just love that. I love that, guys. Not only is this segment important, this is integral in regarding to just your health and your wellness, because you really want to make sure you're doing some of these exercises, you're practicing your own mindfulness. You got to practice your own mindfulness and stop beating up on yourself, guys. Truly stop beating up on yourself, because I see so many times we got to stop comparing ourselves to other people. And truly, it's great for us to be able to hold on as long as we possibly can, because that's what we're talking about, the preventative. But at the same token, we're talking about preserving us. But it's okay if something gets out of, just loose a little bit here or there. That's just a part of life, and it's a part of gravity also, because sometimes things start pulling down.
Yes.
So we have to do the opposite, right? We have to really start exercising even more so. Like when I run, guys, my cheekbones just pop out so strong.
Yes.
Also, you know what's really good for running? Your legs at the bottom area, like your thighs, and also your calf muscles. But I notice like around my stomach area, I get that little line down there. And certain things, if we just maintain a regular regimen, guys, maintain a regular regimen, it's going to improve not only your quality of life, but also the way you look and the way you feel each and every day.
Yes.
Absolutely.
Yes. Totally agree.
Yes. But you know what I love about you guys? You always know how to drop the mic. You drop so many gems. And this is another week of not only our thought leaders coming through for our health and our wellness, but also talking about those stem cells and the importance of how we can add that also into our livelihood. Well, guys, it's almost about that time. I love for you guys to go ahead on and pour into everyone how they can get in contact with you. And then we'll talk about what's going to be our next topic for next week for this thoughtful health and wellness segment. Dr. Z, share with everybody how they can get in contact with you.
Awesome. Well, as you know, I'm Dr. Z with Z Chiro Med Spa in Conyers in Atlanta, Georgia, and where we help people get out of pain, whether it's from work or play. So definitely reach me at 678-754-6877. And you can reach us in all of our, social media platform. Just type in Z Caro Med Spa or Dr. Zeudiann Coleman. Instagram is officially Dr. Zeudiann Coleman. And we can get some more information about this patch, this stem cell activation patch. Everybody needs to get patched. I like the way Dr. Crooks pulled hers off. Here's mine. I'm patched too. So, of course, get the information you need so that you can make the proper decision for yourself and your health. And I'm here as someone to help you along that line, educating you on making those steps. That's what we do. And thank you for tuning in. Thank you, Renee, for, allowing us on your platform again. And let's remember, it's aging gracefully. Aging is going to happen, but we just want to age gracefully and, have more time, quality time. That's the word, quality time with our family and friends, and, be able to do the things we want to do as we age gracefully.
Mm-hmm. Thank you guys for having me. I'm looking forward to, keeping these sessions going, because I want to enlighten people. I like teaching. I like people to ask questions. It's the lack of knowledge why we perish. Okay. So here we are. If I can just give one pearl, 1 week that I'm here, it makes me a happy person. Okay. We depend on each other. We are not an island. And so by saying that, we need each other. Okay. And here is in this forum, I like the fact that I can pass this knowledge on. I am basically working on my website, getting all things working together. And then I am with Eastchester Family Practice. We have a mobile unit that goes from site to site. And the reason why I like this position that I'm in right now, we go where the need is at. And you can basically reach me at that. They have 3 locations, and the phone number is 404-653-0374. If you have any questions, just give us a call about primary care, GYN, OB, and we will, if we can't do it, like I said, we'll figure it out.
Mm-hmm.
And ladies, I just want to say again, thank you, Dr. Zeudiann. Thank you, Dr. Crooks. Thank you for your incitement. Thank you for your knowledge in this space, but also just thank you for your experiences as well, and for those secrets, Dr. Z. Okay, because girl, I have mine, and I need to go get me some Forever Young. Okay.
Oh yes, absolutely.
Yes.
Absolutely. So it's important that we are taking our supplements, we're eating clean, eating healthy, exercise, like you were saying.
Yes.
And let's not forget that that gem called fasting, like intermittent fasting, definitely helps to activate stem cells too, because it puts your body into that position where, like, okay, what's going on here? And then it starts to pull all its gears. So the activated intermittent fasting is also one of my little secrets to keeping some of the weight off and keeping even the hot flashes.
Yes.
Well, we were on earlier this morning with Samira, and as she calls it, the break fast, right? The fast.
Yes.
That's important for us to do that too, that intermediate fasting. And
Yes.
we don't even realize how important that is for us, just to give our bodies time to replenish, just give our bodies time to even just to breathe. We think we need to have 3 meals a day. That's a whole nother topic. And that's what we need to talk about. How are we eating? What is it that we're eating? Because what I want us to do, guys, this would be a good topic to talk about for next week. How long certain foods take to digest in our system. Okay. How long does certain foods take to digest in our system? And in addition to that, all viewers, your homework is to watch What the Health. Okay. What the Health is an amazing documentary that's going to really put a little bit more insight for us also for next week, so we can go into a deeper dive. What the health is like, what the health is going on, right? In addition to that, I want us to focus on certain foods. I enjoy eating seafood, in comparison to maybe chicken, or definitely not, beef or anything like that. But we're going to talk about how long the certain foods take to digest the system, and then the importance of detoxing as well as that intermediate fasting. Is that okay with you, ladies?
Oh,
Yes.
that sounds like fun.
Yes.
That's really
Yes.
important.
Yes.
Yeah, that sounds really, really fun. Well, you know what? Like I said, thank you again for your insight. Thank you for bringing, more clarity to this space. And, just because we want to make sure we are embodying like they say, all roads need to not only lead to GW3, but they need to lead to a healthier GW3. And
Yes.
I'm going to be very in the front of that. I want to be in the back of that. Anyone, if you may need a doctor to give you some regimen, even when it relates to maybe your diet and things of that nature, you have two right here that you can follow up and you can call and just have a consultation, if nothing else, because we are all on the same, like I said, we're all here on this together, guys. We're all in this together. And so we just want to make sure, not only do we want you to know that our health, your health and your wellness is like the cornerstone. It is the cornerstone of how we live a life intentionally. And so I'm so grateful that you've been able to join us this evening with the GW3, GW3 Live with the Global Women Wealth Warriors, as well as the GW3 Global Society. We always look forward to seeing you guys. We want you all to stay healthy. We want you to stay wealthy. And most importantly, we want you to have fun, because we're going to have fun. Okay, we keep our bags packed and we're always ready to go.
Yes.
We really want you to have that healthy mindset, because it's so needed for us in this world that we're living in today. So ladies, thank you for joining us today. I always have to say, we got to make sure we roll our shoulders back and keep our head up. Because why? Because it's time for us to go blaze the universe. The world needs another game changer, and that game changer is YOU. So not only we're so grateful to be here with you guys, but we're looking forward to seeing you on the other side of your greatness. Dr. Z, thank you, beautiful.
Thank you.
Dr. Crooks, thank you again. All right, guys. And we'll see everybody next Thursday, 7 p.m. Eastern Standard Time. Bye.
All righty. Bye.